Finance Committee the nomination of California Attorney General Xavier Becerra to head the Department of Health and Human Services. As chairman of the Finance Committee, I'm going to begin with a simple message. Holding up the nomination of Attorney General Becerra has been blocking urgent antivirus work that needs to get done now. So it is time for the Senate to act quickly without politics getting in the way to confirm this nominee. I also believe, Mr. President, moving quickly on this nomination will help to achieve something I heard a lot of senators talk about over the last few days. A few days ago, I spent almost 24 hours here at this desk while the Senate was debating a number of different issues. Over the course of that debate, and in the weeks before it, many senators talked about how important it was to get past some of the long-standing disagreements and find unity. I will say to my colleagues, there could not be a more unifying prospect for America than ending this public health nightmare as quickly as possible, preventing as many COVID-19 deaths as possible, and helping the American people get back to the activities that they enjoy, that they consider part of their normal daily routine. Having a confirmed secretary leading the Department of Health and Human Services is a linchpin for accomplishing that task. The department is right at the effort, at the forefront, to end this contagion. It's leading the distribution of vaccines. It's working to get PPE into the hands of nurses and doctors who still desperately need more of it. It's getting new resources to rural hospitals to keep them afloat and to keep their doors open to patients who literally have nowhere else to go during this crisis. Health and Human Services is right in the center of the government-wide COVID response. They coordinate work at the Center for Medicare and Medicaid Services, with the Centers for Disease Control, with the National Institutes of Health, with the National Guard, with all 50 states, with the District of Columbia, with private health care systems and doctors across the country, and more individuals and organizations that are just too numerous to name. Now, that's what the job is all about and why it's so critical right now. And I want to turn to some of what I've heard discussed with respect to Attorney General Becerra. I've heard some say that, well, he doesn't have the right leadership experience. That's a comment being made about the head of America's second largest Department of Justice. This nominee is in charge of a $1 billion budget. This nominee is in charge of more than 4,000 employees. The top law enforcement official in what would be the 5th largest economy in the world. This is the work of somebody who really knows how to run a mammoth government agency. So then there's been suggestions about his healthcare background. This is one that, to me, is just bizarre given his track record. He spent years and years on the House Ways and Means Committee, which is one of the key committees in the country with respect to jurisdiction over health care policy. He wrote and debated major pieces of health care legislation, including playing an important role in the development of the Affordable Care Act. As California's Attorney General, he defended the Affordable Care Act in court. When the pandemic hit, he stepped up and fought to protect the health and well-being of millions of Californians, particularly nurses and doctors and other workers who found themselves in harm's way. Now, when you're in the Senate, you understand that members of the opposing party are going to have disagreements on policy issues. That goes with the turf. Women's health care was obviously one of those issues that came up during the nomination hearing. I will tell you that Attorney General Becerra's response is what we ought to expect of responsible public officials and of nominees. He made it clear to members of the Finance Committee. He said again and again and again that he will follow the law. He will be accessible to all senators. He's going to work to find common ground on key health care issues. And I can tell you, having specialized in health care since my days with the Oregon Gray Panthers, that is heavy lifting. And by the way, I think it's pretty refreshing after 4 years of just blather about repeal and replace and empty rhetoric and promises on pharmaceutical price gouging and partisan policies that favored insurance companies over the typical American consumer. In my view, Attorney General Becerra proved in his nomination hearing that he knows health care policy inside and out, and that he is ready to lead the Department of Health and Human Services. And I don't think anybody ought to be particularly surprised, because he has got a decades-long track record of health care leadership and policy experience that's going to help him succeed in the job. We all understand that the country's health care system is still under extraordinary pressure and strain. On Saturday, the Senate passed one of the largest public health packages in our country's history, designed to crush this pandemic. So we're starting to see some light. We're starting to see the end of the tunnel. And the Biden administration is doing everything it can to acquire more vaccines, to get more shots into arms. I think we all understand it's not a task completed yet. I'll just close by way of saying that when our country faces a health care crisis, it needs a Secretary of Health and Human Services confirmed and on the job as soon as possible. It doesn't need more political games and delay that only sets back our effort to end the pandemic. So we'll be voting, I believe, in less than an hour, Mr. President, and I just want to say that I hope colleagues will support this nomination's discharge from the Finance Committee. I have known the Attorney General for a number of years. As I say, this is the area that I have specialized over the years. And I know that senators have differences of opinion with respect to health care. I get that. But those differences of opinion shouldn't stand in the way of a qualified public official who's managed thousands of people in his current job, for example, from having the opportunity to do what has to be done for this country, and that is to get a confirmed nominee for a critical position so that he can attack those challenges that are in front of us right now and help patients and speed up the effort to end the pandemic. Mr. President, I yield the floor. The absence of a quorum.
Clerk will call the roll.
Ms. Baldwin.